Bismillahirrahmanirrahim. Today I am going to discuss a case study related to cardiology. A 64-year-old man who is diabetic, point number one. Point number two is hypertensive. In the past few months, he was complaining of SOB, shortness of breath. But nowadays, now develops severe SOB, severe shortness of breath, and chest pain. Severe shortness of breath and chest pain nowadays. The pain characteristics. Pain is characterized by sharp. The pain is sharp, and pain pain is worsened by breathing. When he take breath, the pain is also increased by breathing. Most important point, the pain is relieved by sitting forward. When he is sitting forward, or when he sat forward, leaning forward, the pain is relieved. Here, what is the single most appropriate diagnosis? Now we will find the most appropriate single diagnosis in option A, B, C, D. We will find the right option. MI, myocardial infarction, pericarditis, lung cancer, progressive massive fibrosis. Now I discussed a case study that a man who is diabetic, hypertensive, okay, and he was complaining in the past few months or few days SOB, but now the shortness he complains, severe SOB plus chest pain. But the pain is characterized by sharp stabbing, okay. Pain is exacerbated by what? By exertion, by walking, and when he sit forward, okay, pain is relieved. So what will be the right option of the following diagnosis? Okay, in the next video I will discuss the whole mechanism and the right option that I will discuss in the next video.